Hello, my name is Jane Aherne and I work with IVF Matters as a nutritionist, and in this video I want to talk about type 2 diabetes and insulin resistance. Now, if you're currently thinking of going for IVF treatment or in the middle of the treatment, or whether you are just recently pregnant, if you have insulin resistance, type 2 diabetes, or recently had a blood test that has shown high HbA1c levels, high C-reactive protein and high fasting insulin levels, you certainly need to manage your insulin in order to have a healthy and safe pregnancy and success with your IVF treatment, and or should I say success with your IVF treatment. So type 2 diabetes, it is on the rise and has been for a considerable amount of time. It is something we all need to be aware of, and it certainly needs to be managed if you have been diagnosed with the condition. Thankfully, it is actually fairly straightforward if you do want to manage type 2 diabetes and actually reverse it. Certain lifestyle factors will have to be taken into consideration, given that the majority of people suffering with type 2 diabetes or living with it, it will be due to lifestyle factors. It's not always excessive eating. It can be due to stress, lack of physical activity, and many other reasons. But managing insulin is key to success with reversing type 2 diabetes and increasing insulin sensitivity in those with insulin resistance. So in order to do this, there's a few things we would take into consideration. I already mentioned physical activity. So certain exercises are better at improving insulin sensitivity, and as a nutritionist I can help you guide you through this and also focus on the foods to have to help this exercise be successful and help with muscle gain and muscle protein synthesis, and that would also lead to better sort of body composition and help manage insulin and reduce body fat as well and weight. Another factor to consider is carbohydrate intake. Now, I'm not necessarily an advocate for the keto diet. I think carbohydrates are good. Fiber, a lot of fruits and vegetables will contain our micronutrients that are essential for health. But managing your carbohydrate intake is definitely something you must do in order to successfully reverse insulin resistance and type 2 diabetes. So coming up with meal plans, or even just different recipes that will allow you to feel satiated without having a high carbohydrate intake is what I would do with someone suffering from type 2 diabetes or insulin resistance. Now, if you're on any medication for this, this is also something that needs to be considered, because you have to be careful with certain medications for insulin resistance or type 2 diabetes and the amount of carbohydrate you're intaking, because the last thing we want is anyone going into a hypoglycemic attack because they've suddenly drastically lowered carbs and it's not being able to be managed well. Supplementation is also another factor. Now, again, with supplements, I have to meet with an individual before I would recommend anything, but there are certain supplements out there on the market that work just as well as the best medications for type 2 diabetes, and they're completely natural. So that is another consideration. It wouldn't be any sort of diet of no carbs and pills. It will definitely be a healthy, nutrient-dense lifestyle change for those trying to manage type 2 diabetes, especially if you want to eventually get pregnant. And we would also encourage you to eat foods that would be really beneficial for pregnancy and healthy for baby, and make sure you're not lacking in any of them if you do decide to reduce carbs. So I hope that has been helpful. If you need any other information on type 2 diabetes and insulin resistance or help with that, please get in touch. And thank you so much for listening.